I love Dr. Nazarian. She did my designer vagina. We went live with you on Instagram for this. You were a part of that moment. And on a real note, I'm having some real situations, and I was trying to make a decision because I cannot focus. I've been having monumental headaches. Like when I say this, I wake up out of my sleep, I can't sleep, I can't focus on my work, so I have to make a decision, and it's for real. I know we've all seen me have crossbite issues, like on Team Wall and through the years. I'm still struggling with that, but I cannot get rid of this lockjaw situation and these headaches. So I asked Dr. Nazarian to help me out today. And I know that you have said that you get headaches. This is super common.
I do. I actually get them right here, and I treat it with neurotoxin. Farrah's getting them in the temple. I have to treat my jaw too. I've been treating mine for like literally 6 years, and if I don't, I got lockjaw last June when I fell behind. Like I literally couldn't open my mouth.
Well, luckily I'm not doing too much on the phone and stuff, and I'm locked away in my house. And by the way, we were being super safe, like with masks, cleaning, alcohol, shoes, everything. But this was kind of like, I need this so I can do my work.
Yeah.
So lockjaw, headaches, how are we going to fix this today?
So we're just going to put a little bit of muscle relaxant, which is temporary, lasts anywhere between 3 and 6 months. But
3 months of no pain,
yes,
thank you.
But, and also like my patients will message me like 1 to 2 weeks after we do it with like when they start feeling the relief. So this is very functional. You can see on Farrah too, she's got pretty big muscles in her lower jaw. You can see it kind of, you know, you can almost make out her muscle. So I know she's kind of bodybuilding that muscle, and that can affect your teeth. It can affect TMJ. It can cause headaches. And also we're going to do a little bit of neurotoxin in the temple muscle as well, which is also a muscle of chewing. So she's just grinding, she's clenching, there's stress in the world, anxiety levels are just in general really high right now, and so this is a really common problem.
Okay, well, thank you so much for helping me with this. And this is how easy it is. I do have a little bit of makeup on. We've cleaned it with alcohol, of course. And this is how easy it is to fix it. So if you want to reach out or watch all this stuff, Skin Decision on Netflix. By the way, my heart was just like you guys are gonna love everybody who's making skin decisions on there with Dr. Nazarian and also her nurse friend.
Yes, Nurse Jamie's on there with me.
So we really enjoy this. Check this out, ladies.
Yeah, so I'm gonna kind of put your face like this, and I'll teach a little bit, you guys too. So basically, I'll have her bite down a teeny bit. I know it's painful to do so, but you can kind of make out the muscle. So we're basically just gonna go in, and sometimes it feels even a little bit crunchy. So I'll put a little bit in, pull back on the syringe, plunger before you pull out. There's also a lot of muscles of smiling that are more superficial, more towards the skin than the jaw muscle is. So you want to make sure when you're getting injected, your injector knows to inject, pull back on the plunger so you're not backtracking neurotoxin through the smile muscles and temporarily paralyzing those as well. So a lot of people know that, some people don't know that, and I've seen people come in and be like, oh, I had that done and my smile was off, and it's like, well, because, you know, they didn't do this technique. So we're injecting, pulling back, injecting, pulling back. Bite down one more time. Yeah, right. This little tail is also missed a lot. The other mistake I see a lot on Instagram is people are injecting at an angle, which means you're basically going to get the smile muscle. So,
can I talk now?
Yeah, go ahead.
Okay, so I thought that was so important that you were seeing this scale and these bits so your smile is off. I have been made fun of by my other castmates for like having crooked lips and smiles off and all this stuff. And it relates towards my jaw. And I really feel like a lot of us women who are trying to look our best, fill our best, align our best, that is for our doctors. Dr. Nazarian was saying something very critical about not letting our smiles get off. So please note that with your doctors. Make them watch Dr. Nazarian. Call her up. She is like your lifeline. Yeah. Okay, so that's great that you
and it's so great that Farrah like shares this stuff with you guys, because a lot of people in the influencer world or celebrities that come to me will never talk about anything, and they just say, I've been working out, or I, did a cleanse, and I drink a lot of water, which are all great, but we all know that's not actually what's going on, and I think people should be more honest like Farrah and talk about their experiences and the treatments that they're getting, so that it's not setting unrealistic expectations, not just for us, but for our daughters. So let's do the other side.
Like, my daughter is going to be going through braces and all that stuff soon. I want her to know the truth.
My kids too.
Oh.
Seriously. 1, 2, 3.
smile on purpose, but when I clench down, like that's me trying to get comfortable because I'm uncomfortable in my jaw area right now.
I just can't let this go. Every last chance I had is gone, but I just can't let you know.
This side's a little bit stronger, huh?
Mm-hmm.
So I'm giving about 20 units on each side too, just for you guys to get if I do. In the studies for neurotoxin in the jaw, they usually talk about 40 units on each side, and I just found in some people that's necessary, but most people 20 units is plenty. And you can always go back and get more, but it's just nice to start with 15 or 20 so that you're not paying extra for stuff you don't need. Okay, now let's go to the temple. So point out with me with one finger kind of where in your temple.
Like it's exact.
Exactly right there.
And I know like my fingers,
Yeah.
but like it is exact intensely on my temples.
Okay, right in the middle. Again, let me just grab it.
Oh, come on. And I know like some ladies do go, like when we're talking about like aesthetics and appearance, which I know we're specifically talking about headaches right now. We're not trying to oval the face. Like this is not gonna oval my
No,
temples.
this isn't filler.
Like,
This
like
is
this
just
is-
a temporary muscle relaxer.
okay.
That's all it is. I actually do fill my temples because I look like a peanut head, I call it.
I do get peanut head. I'm sure
Yeah.
I probably have a peanut head. Don't look at that. But like headaches are so severe right now.
And you guys, I just want to say, like, Farrah hasn't gotten anything done in a really long time, and she still looks this good.
Yeah.
I swear, I
Thanks.
was like falling apart in quarantine. I had to sneak in here and like take filler home.
Look, I'm just trying to get through my school.
I know. Right here.
Yeah. All these long nights and all this stress.
I know, girl. Do you feel like it's a little bit up here too? Or
Yeah,
mostly
I
just
mean,
right
it
where
goes
I'm
up the whole side of my head.
What about
So,
here?
yeah. I mean, it's like severe headaches lately, ladies. And I don't know if this is just because, like, there is just so much stress going on in the world, or
at?
like,
It is. And you're studying,
yeah.
which is a lot of like eye strain too. That one felt really like relaxed. So sometimes what happens is the fascia overlying that muscle will thicken because there's just so much inflammation and so much use of that muscle.
Oh my god.
So when I go in with my needle, I can hear it and I
Yeah.
can feel it. It's almost like putting it through burlap. It's like when
Yeah.
it goes in.
And I'm trying not to do as much medication, like aspirin stuff.
The other thing too, I just want to point out as an educational thing, a lot of times when people have active jaw muscles or temple muscles, their dentist will tell them to get a bite block. But a bite block will help your teeth not grind down, but it becomes a chew toy for you to chew on
So
even
that is
more.
what I've been having an issue of.
Yeah.
So what do you think with the chew stuff?
That's what I'm saying. So if you get neurotoxin in those muscles, it actually prevents the problem rather than giving you a chew toy. So I always tell my patients before you get the bite block, try, Botox, Dysport, Xeomin, Jeuveau, whatever neurotoxin your doctor thinks is right for you. Get that first because that will actually prevent the pain. It'll prevent the TMJ from getting worse. It'll prevent you from grinding down your teeth and your fillings, which I've seen.
Mm-hmm.
And it's a relief. Like literally it's a functional relief. So today, I know usually we're talking about aesthetics, but this is such a high satisfaction procedure because it's not just narrowing down your jaw. It's actually giving you a functional relief and saving your teeth. So it's awesome.
Yes, and I've spent a lot for these teeth, like 50,000 or more. So if you really care about cosmetic dentistry, keeping your teeth, keeping your alignment, not having chew toys with your night guards, thank you.
You're welcome. So easy. Girl
So
done.
this is all it took, painless, and I hope you guys have no more headaches, pain-free, and no more locked jaws. So you
And
can
watch
see
Skin Decision on Netflix.
Skin Decision on Netflix, and my heart just loves that show. So I hope you guys love it too. I'm not just saying it because she's saved my vagina and now my head, but I just love Skin
No, you
Decision.
guys, it's a totally different aesthetic show. It brings people that have had trauma in their lives, and it just highlights, as plastic surgeons, what we do for people, not just on a physical level, but on an emotional level, just helping them feel whole and good about themselves.
Yes. And
it's
like
a beautiful show.
Like the ladies and the men giving back to their communities. They're like, if you help somebody, it just magnifies. So she wins the award of brightening the world, sharing her light, and magnifying the light to everyone else who can do so much good. So that's why I love this.
Yay!
So go check it out. We love you guys.
All right, bye.
See you later.